This is Oral Rehab Lecture 2. This is the first screencast of 3 that covers the topic of problems and consequences associated with hearing loss. We'll talk initially here first about some universal factors that can create communication problems for a person with hearing loss, and then talk specifically about some problems that may be more adult in nature and more pediatric in nature. And along the way, we'll start to introduce some concepts that might be sort of treatment and sort of giving us an idea of what we can do to help people. This 3-part screencast is covered in your Lecture 2 slide set. This first screencast covers slides 1 through 11. There's 3 problems or 3 factors really that contribute to communication problems. The next couple slides I'll review these in just a little bit more detail, but in one view quickly here we see that these universal problems are number 1, that some people just simply don't hear as well as others. I'm going to operationally define that in a moment. Number 2, some people don't understand speech as well as others. We could relate this to a loss of speech analytic abilities. However, the person with this particular problems, his or her complaint will be that speech is not clear. And thirdly, we're going to refer to the influences of the environment primarily in a negative or a degrading kind of effect. Now, it is possible that the environment can contribute to improved communication, and in fact, we'll talk about that throughout the course. But for the purpose of what are some universal factors that generally make communication worse, generally can make communication problems, create communication problems, it would be these 3. Now let's talk about the detail here just a little bit. Now this first one, what I refer to as loss of sensitivity, the fact that some people don't hear as well as others, might be more generically referred to as loss of audibility. And really what hearing loss is a measure of at what point does an individual begin to hear sound. So if there was a larger dynamic range and now all of a sudden that dynamic range has been restricted, it means that the person is not able to hear. The material is not audible at the point below which they're able to organically detect sound. So we typically hear, wherever it is that we begin to hear, when we have a hearing loss, we lose the sounds that are softer than that. But once we get to the point, the threshold of audibility, we're able to hear sounds at that amplitude and higher. So essentially we are missing information. We're missing the softer sounds, and the problem comes in is when people miss the softer sounds of conversational speech is when hearing impairment becomes more problematic, typically, generally, is what we would predict. What I want you to think about and remember is that hearing is an event that occurs in your brain. And the auditory system simply is a mechanism to capture and convert acoustic energy from the environment and convert it into patterns of electrical pulses that are able to be processed at your brain. In this sense, then, any pathology in the auditory system, in the outer middle inner ear auditory nerve, that serves to capture, translate, and convey that information. Any pathology there results in inefficient processing, but really the best way to think about it, in my view, is to think about it that there's incomplete information. So the representation of what the talker, the speaker said, is going to be incomplete once it arrives at the brain of the listener if there's an auditory pathology. The degree of the completeness or lack of complete information generally is going to follow the audiometric criteria called degree of hearing loss. We'll deal with that more in a later slide set, but that's material you covered in the audiometry class that you had. The lack of information or the minimalization of information coming through the auditory channel is going to be most pronounced when the pathology is in the cochlea, in the inner ear, or along the auditory nerve pathway. Somewhat associated terms with this notion of loss of sensitivity, poor sensitivity, reduced sensitivity, impaired sensitivity. Again, remember the idea is that sensitivity is the basic test on the audiogram. Sensitivity is a test that generally refers to what's the least amount of a stimulus you're able to detect. So when we refer to auditory sensitivity, that's the nature of the audiometric task. What's the least amount of amplitude an individual needs to be able to hear a specific frequency. That's the nature of what audiometric testing is. So the whatever we call it, reduced, poor, impaired sensitivity, the point's still the same. The person who has what we're going to call hearing loss or hearing impairment needs more sound energy in order to hear the acoustic signal. Now, second operational universal factor that contributes to communication problems is the fundamental idea that some people don't understand speech as well as others. And we referred to it earlier as a loss of speech analytic ability. In this particular way of thinking about it, there's going to be now not only incomplete information, but the information that's getting through the auditory system is going to be degraded, and so therefore the interpretation at the brain is going to be potentially ambiguous. In older audiologic and older audiometric terminology, it's sometimes referred to as speech discrimination. It's generally said that's not the most accurate, most contemporary way of describing that, but you may hear that as somebody's speech discrimination score. It's more properly referred to as a word recognition score, strictly speaking. But the outcome certainly is that the person might hear the word but not have enough information to understand it. That's the basic premise of it. The key factor about loss of speech analytic ability is it's not predictable based on degree of hearing loss. Another way to rephrase that is someone who has relatively good hearing, some hearing loss, might have a very poor speech analytic ability. Conversely, someone might have a very poor auditory sensitivity and somewhat have better word recognition and speech understanding than you might expect. So the audiogram does not help us to predict exactly what their speech understanding ability is. This loss of speech analytic ability is going to be much more problematic when it's due to a pathology in the cochlea or along the auditory nerve pathway. So fundamentally, the basic premise here is that some people just simply don't understand speech as well as others. Speech is not clear. That will be their behavioral complaint. Third, generally said, the environment is going to degrade the quality of the intended signal, the intended acoustic signal. The basic contributing factors to environmental degradation of an acoustic signal will be background noise, reverberation or echo, and the distance from the sound source. You probably learned in your acoustics component, or possibly in your hearing science class, that as you get further away from the sound source, the amount of amplitude decreases in a reasonably predictable way. So it's these three factors are going to contribute to communication problems. So to sum that slide up, the environment generally said has a negative effect. When we think about a person with hearing loss, what's the likely sort of presentation or the likely sort of problems they would likely have? I would logically say they would have three basic problems then. They would have problems in audibility, that is to say some sounds are not going to be detectable. They're going to have problems in word understanding, that is to say their behavioral complaint is going to be speech is not clear. And finally, they're going to have problems hearing in the environment. If you recall back to the basic facts video slides, video series from the Hearing Loss Association of America, you'll recall that that was one of the primary complaints of adults with adult onset hearing loss is hearing and understanding speech, particularly in a background of noise. The key question, of course, is when do the above, problems in audibility, word understanding, and hearing in the environment, cause hearing problems? The answer is we really never know, because it depends on the person, it depends on their situation, and on their circumstances. So when does a person with hearing loss have hearing problems and needs? Again, we don't know. It depends on the person. It depends on their specific circumstances. Now, paradoxically, we can ask the question, can a person with significant hearing loss, whatever that is, have no hearing problems and needs? And if so, under what conditions? So the answer is a resounding yes. And the conditions that would dictate when someone who has measurable organic hearing loss have no problems and needs, you'd have to go back to the list of factors sort of toward the end of lecture set 1, part 4, in which I sort of laid out what are some of the things that contribute to the heterogeneity of persons with hearing impairment. So the key one here, and there are probably many, but the major one that you should already be thinking about is, when does a person who has measurable hearing loss have no hearing problems and needs, would be when they have no communicative demand, when their lifestyle is essentially devoid of a need to communicate, when they have no frequent communication partner. Now, this all imposes a fairly sad circumstance for that particular individual, but it's also one that is very possible and maybe even probable. So in this case, hearing loss but no problems and needs, fundamentally based on lifestyle. The other converse question: can a person with no significant hearing loss have significant problems and needs? And the answer is, again, paradoxically, yes. And there's actually a sort of a subset of persons who have hearing within normal limits that have a reasonable behavioral complaint set about that they have difficulty in hearing and understanding, and particularly in a background of noise. It's been given a name called King-Kopetzky syndrome. And as when I worked at Kaiser Medical Center in Baldwin Park for a few years, we estimated that we probably had maybe 15% of our total caseload were patients that sort of fit this profile of they had a complaint about hearing, particularly in a work situation, and they went through all the bother of coming in for a hearing test. We test their hearing's within normal limits, and so we had to sort of say, yeah, your hearing's within normal limits. And they don't take that news well. It's a surprising sort of thing. So they required some counseling to say, well, yes, your hearing is actually pretty good, and your problems in functioning with hearing maybe not is due to a pathology in your auditory system, but maybe more in the background noise that you're in or in other aspects of your listening condition. All right, on that, we're going to conclude here at slide 11. We'll pick up at slide 12 in screencast 2.